Hello, this is Dr. Gay from First Look MRI, and this is a middle-aged male who does martial arts. He has pain in the anterior knee that comes and goes and knee swelling, and this is a case of what we call Prepatellar Bursitis. It's inflammation in front of the kneecap. So on this view we can see this big bone called the femur. Behind the femur are the calf muscles back here. The table the patient's laying on would be back here. Now the front of the knee is this direction, pointing upwards, and the kneecap is in the front right here, and in front of the kneecap we see the abnormal findings. All this bright stuff here is fluid and inflammation in the prepatellar subcutaneous soft tissues. And on this view, fluid is really white, so this little skinny band is white fluid. This is the inflamed bursa. And then around that, this more gray signal is edema in the subcutaneous fatty soft tissue. So just a classic example of prepatellar bursitis. If we look from the side, we see the kneecap over here, and the abnormal signal is in the front here. And now this view, it looks dark. And you can see the thickening of this dark area. This is the inflamed soft tissue. Now in this view, the abnormal signal is bright. Any inflammation or fluid is bright. So you can see how thick all this soft tissue is. This is the kneecap looking in profile. This is the femur, tibia, and you can see how swollen this is. And the really thin band of white stuff here, this is the fluid, the inflamed bursa. Again, this edema that's all around it, this more gray, is the subcutaneous soft tissue. So a nice classic example of prepatellar bursitis, inflammation in front of the kneecap.